So today we are going to be talking about um, antimicrobial resistance, the silent global health crisis. Now, you're welcome to this month's live session, and our guest is a renowned microbiologist. So, we are going to be discussing antimicrobial resistance and how it is a silent global health crisis. Welcome, Mr. Femi.
Yeah, thank you, Mr. Progress.
All right. So, move quickly. We don't intend wasting so much time. We'll move quickly to the first question. I hope you can hear me.
Yes, yes, very well.
All right. So, let's just establish the background here. What is antimicrobial resistance and why should we care about it?
Okay. From my own perspective, antimicrobial resistance it occurs when microorganisms such as bacteria, viruses, fungi, and parasites develop mechanisms to resist the effect of antimicrobial agents, including antibiotics. Now, these
Oh,
mechanisms, it develop it develops mechanisms such as genetic mechanisms, like we have mutations, gene transfer, and gene amplification. We also have biochemical mechanisms that causes antimicrobial resistance. We have the enzyme mediated resistance. We have the efflux pumps. We also have the target modification, and we also have the physiological modification mechanisms such as biofilm formation, persistent cells, and cell wall modification. Now, this biofilm formation is just like when bacteria form a kind of attachment to a surface, and once they colonize the area, they form this kind of resistance that protect them from any this thing trying to invade their environment. So that is what causes antimicrobial resistance. We also have the environmental mechanisms where we have the selection pressure, horizontal gene transfer, and co-selection. Can you hear me?
all right, all right. Yeah, I
Yeah.
can hear you. I can hear you.
Okay.
Thank you
Thank
very
you.
much. You have said a lot. The layman will naturally not understand all these things you have mentioned. So we'll try to break it down
All
as
right.
much as we can.
No
Yeah.
problem.
So the second question, how does antimicrobial resistance affect the effectiveness of antibiotics and other
Okay.
treatments? How does
Okay.
AMR?
There was a question that comes before. I think number two. They said why we should care about it. Why we should care about it is because
Why we should care about it?
yes, it threatens the ability to treat infectious disease, thereby making them more difficult and expensive to manage in the long time run.
Okay,
Yeah.
okay, okay. So over to the second question. So how does AMR affect the effectiveness of antibiotics and other treatment?
Mm, Antimicrobial resistance, it reduces the effectiveness of antibiotics by allowing resistant microorganisms to survive and multiply, thereby making infections harder to treat. Now, this can lead to prolonged illness, which causes mortality on the long run and higher
Okay.
care costs. Now, that is how it affects the effectiveness of antibiotics and other
Antibiotics.
treatments. Yes,
Okay. Okay. Thank you so much.
you're welcome.
Okay. So what to the third question, what are the main causes of antimicrobial resistance worldwide, not just in Nigeria or in this part of the world, worldwide? What are the main
Now,
causes of AMR?
I think the main causes includes overuse and misuse of antibiotics. One,
Okay.
poor infection control practices. Two, then lack of new antibiotic development. We also have inadequate hygiene and sanitation. And the final one is the agricultural use of antibiotics. All these are the main causes of antimicrobial resistance worldwide.
All right, all right. Thank you so much. So to the next question, why is AMR considered a silent global health crisis? Why is antimicrobial resistance considered a silent global health crisis from your own
Um,
perspective?
my own perspective, antimicrobial resistance is considered a silent global health crisis because it develops gradually, often unnoticed, until it becomes a significant public health problem. Its
Yeah,
impact is felt worldwide, but it receives relatively little attention compared to other global health issues. So that's why it's considered a silent global health crisis.
all right, all right. Thank you so much. Okay, so to the next question, what role does the misuse or overuse of antibiotics play in AMR? What role does the misuse or overuse of antibiotics play in AMR?
And the misuse and overuse of antibiotics accelerates the development of antimicrobial resistance by exerting selective pressure on microorganisms, whereby it favors the survival and spread of resistant strains of these microorganisms. Now, let me explain the concept of selective pressure in a simpler terms. You know,
Yeah,
imagine you have a garden with weeds. You want to get rid of the weeds, so you use a weed killer, right?
yeah,
At first, the weed killer wants works greatly and most of the weeds died. But however, some weeds might slightly be different from others, making them less affected by the weed killer. Now,
yeah,
these weeds might have a special trait that helps them to survive. As you continue to use the weed killer, the weeds that are susceptible to it will die.
yeah,
Now, leaving behind the ones that are resistant over time, the resistant weeds will multiply and become dominant.
yeah, yeah, yeah. Hello, Mr. Femi. Can you hear me? I think we have network issues here. Can you hear me, Mr. Femi?
Okay, I
All right.
think
Thank God you're back.
all right. It was a network glitch. So now, the explanation I gave now, this is similar to what happens to bacteria and antibiotics.
Mr. Femi, please, your volume is very low.
Very low, very low. Okay. Is it okay now?
Better.
Better. Okay. If it is low, I can maybe use my voice and remove earpiece. Okay.
No, no, it's okay.
It's okay. Okay. This is similar to what happens with bacteria and antibiotics. When we overuse and misuse antibiotics, we create a selection pressure. Now, those selection pressure favors the growth of bacteria that are resistant to those antibiotics. As a result, the resistant bacteria multiply and become more common, making the infection harder to treat.
Yeah, yeah. All right. Thank you. So let's go to the next question.
Okay.
How does the AMR impact everyday medical procedure like surgeries and cancer treatments?
Okay. Antimicrobial resistance increases the risk of surgical site infection and
Please, could you use your
complicates.
microphone?
Okay. Okay. Is this good? Okay.
Better, better.
Antimicrobial resistance increases the risk of surgical site infection and complicates cancer treatment by making it harder to manage infections. Now, this can be life threatening, we all know, for immunocompromised patients.
Patients, yeah.
Yes, yes. Now, imagine you need to undergo a surgery, maybe to replace a knee joint. To prevent infection from your doctor, you will typically be given an antibiotics before and after the surgery. However, if the bacteria that cause infection are resistant to the antibiotics due to antimicrobial resistance, the antibiotics will not work effectively. Now, the risk of serious infection can lead to prolonged hospital stays, increased risk of complications, and higher risks of death. That's the result.
Okay, okay, okay. Thank you. So basically, what you're saying is that antimicrobial resistance can
Yes.
affect surgical procedures, and
Yes.
with the rate at which it's going now, doctors may not even be able to perform surgical operations because of
Yes.
antimicrobial resistance.
Yes.
All right,
Now,
thank
just
you.
imagine.
So moving,
Just im- okay, okay. I wanted to add. Just
yes, please.
now, just like for cancer treatment. Now, cancer patients, they do undergo what we call chemotherapy. Now,
Chemotherapy, yeah,
yes. Now, this weakens their immune system. To prevent infection, they may receive antibiotics as part of their treatment. Now, however, if antimicrobial resistance is present, the antibiotics may not work effectively, putting the patient at risk of developing serious infection. You understand?
yeah.
Yes.
All right, thank you so much. So moving to the next question.
Okay.
What are the potential economic consequences of a world where AMR is widespread?
The economic consequences of widespread of antimicrobial resistance could be catastrophic. Now, with the way things are going up, let's just say with estimated annual costs ranging from maybe 20 trillion to 100 trillion by 2050. Before we get to 2050, we might have a result of 20 trillion to 100 trillion of it. Now,
Yeah,
making it one of the most significant threats to global economic stability. So that is the economic consequences of the widespread.
yeah.
Yeah.
And to add, people don't really understand the depth and the importance of antimicrobial resistance until we have a disease breakout and we don't see something to get rid of it, especially if it's a microbial infection. So people think it's all about every other thing they do and they neglect the health part. Just imagine what happened in COVID-19. Nobody walked, nobody went to anywhere, everybody was indoor. Like that is how. So imagine something happens and then we cannot really find a way to curb the whole situation because the bacteria they're already resistant. You get,
Yes.
and so it will be a very, in fact, that alone can even keep us longer in the house more than COVID-19, because while you are trying to look for a way to curb these bacteria, some of them can actually still mutate, and so that mutation as well can also prolong the time
Prolong, yes.
if you get an antibiotics for it. Okay, so quickly to the next question.
Okay.
How does AMR spread between humans, animals, and environment? Because you mentioned before, I think you mentioned something about agriculture.
Yeah.
Yes, yes. So I think that should come to play here.
Oh
So how
yes.
does AMR spread between humans, animals, and environment?
Okay. Now, they spread through what we call direct contact between humans, animals, contaminated environment. Now, the indirect contact can be a result from the food, the water, and air. We also have
Okay.
horizontal gene transfer through microorganisms. Now, for human to human transmission, antimicrobial resistance can spread between humans through direct contact. Now, touching or shaking hand with someone who has a resistant infection can actually lead to that. And indirect contact, touching contaminated objects or surfaces, can result to antimicrobial resistance. Now, we also have droplets transmission. We have the inhaling respiratory droplets from someone with a resistant infection. All this
Yeah.
can be transmitted human to human. Now, from animal to human, uh, we it's just kind of the same play. Now, antimicrobial resistance can spread from animals to humans through the water. Now, drinking or swimming in water contaminated with resistant bacteria. We also have the food, consuming undercooked or raw meat, poultry or seafoods contaminated with this resistant bacteria.
Yeah.
All this can result to the transmission of antimicrobial resistance, and touching of animals or their environments, such as farms and petting zoo, result to antimicrobial resistance. Now, for the environmental aspect to human transmission, it spread from environment to human through water, drinking or swimming in water contaminated with this resistant bacteria. The soil, coming in contact with contaminated soil or dust, can result to antimicrobial resistance. The air we take in, the inhaling of the airborne resistance, can result to that. Now, animal to animal transmission of the antimicrobial resistance, it can spread through direct contact. Now, the animals touching or interacting with each other. We also have the indirect contact, which is touching contaminated surfaces or objects. Their
Yeah.
food and water too, consuming contaminated food or water. The spread of antimicrobial between human to animal and environment. Now, it highlights the need for a one health approach which recognizes the interconnectedness of human, animal, and the environmental health. Yes.
Yeah. Yeah.
Thank you.
Thank you so much.
You're welcome.
All right. So moving to the next question. What are, and this is very important, what are some diseases that have become harder to treat
To treat.
because of AMR, because of antimicrobial resistance?
Yeah, we have so many, but I will just mention five. Now,
Okay.
one of the global diseases that has become harder to treat, we have the tuberculosis, which is caused by Mycobacterium
Mycobacterium
tuberculosis.
tuberculosis. Yeah.
Yes, we also have malaria caused by this Plasmodium falciparum, uvula novelensis, and vivax. We have the pneumonia caused by bacteria, caused by Streptococcus pneumonia, Haemophilus
Mm,
influenza. We also have Klebsiella pneumonia, Escherichia coli. Another disease that has become harder to treat is the urinary tract infection. Now, this is caused by Escherichia coli, Klebsiella pneumonia, and Staphylococcus saprophyticus. And the last one on my list is the gonorrhea, which is caused by Neisseria gonorrhea.
I was expecting this one.
These are the diseases. These are diseases that have become harder to treat because of antimicrobial resistance. Yes.
Okay. Okay. Thank you.
You're
So to the
welcome.
next question, how can we or individuals combat AMR in their daily life?
Okay, individuals can help combat antimicrobial resistance by only using antibiotics when prescribed by a healthcare professional. Now, taking
Okay.
antibiotics, you must follow lay down procedures. Now, if you're just like commonly we'll be told that we should take these antibiotics 8 hourly, morning and night or something like that. Now, you should have a consistent timing by not
Yeah.
deviating from that time. Hey, just like in the morning, it can be 8 a.m. and you must eat before you take it. In the evening, maybe 7 p.m., you eat before you take it, taking it consistently till the next day. Now, completing the full course of antibiotic treatment, practicing good hygiene and sanitation, avoiding self medications, and support antibiotic stewardship initiatives. All this can help combat antimicrobial resistance in our daily lives.
All right. All right.
Yes, yes.
Thank you.
You're
Now,
welcome.
to my next question. This is very,
Okay.
you have talked about it, but you have to still um talk on it again. What are the risks of not completing prescribed antibiotics?
The risks. The risk is it can lead to prolonged healthcare infection. You know, when you can develop all this antimicrobial resistance when we do not complete the full dose of antibiotics. You understand? It will now lead to prolonged hospital stays and the disease keep reoccurring. You think you have treated it, but it will definitely come back. Yeah.
All right. Okay.
Yes.
Thank you. The next question I have here: how does poor sanitation and hygiene contribute to AMR crisis?
Okay. I think it allows the spread of antibiotic resistance. It increases the risk of infection, which can drive the misuse and overuse of antibiotics. It also hinders the effective management of infectious disease.
Okay. Okay. Thank you.
Yes, you're
And
welcome.
finally, what are some innovative solutions or alternative to combat AMR, even though it has not been put into practice, or it has not um, been signed into bill? All those are things that they used to do. What do you think? What do you think are innovative solutions or alternative to combat AMR?
Um, I think developing new antibiotics and alternative treatment, such as bacteriophage. You know, these bacteriophage, they are like therapy that are specific to this target to target they target specifically more than antibiotics. You understand?
Yeah.
Without altering the microflora. So now
Yeah.
improving antibiotic stewardship through artificial intelligence and machine learning can also be used as alternative to combat antimicrobial resistance. We also have enhancing infection prevention and control measures. Now, promoting the use of antimicrobial peptides and other novel antimicrobial agents. Now, all these are alternatives to combat antimicrobial resistance. And the last but not the least is education. Now, you sensitize the people on,
Sensitization. Yeah.
yes, sensitization. Yes, all these are innovative solution. Yes, thank you.
All right. All right. Thank you so much. Now, before you go, you just do a summary, of everything we've talked about in this live session. Maybe in 1 or 2 minutes, just do a few summary.
Okay, now antimicrobial resistance, which we call AMR, they are microorganisms now that are common. We have the bacteria, fungi, virus, protozoas that that have this kind of resistive mechanisms to prevent the treatment of infections. Infections, you understand?
Yeah.
Now, these infections may become harder to treat and it may lead to prolonged illnesses, which increases mortality rates and greater risks of disease spread. That is what
Okay.
AMR can cause. Now, why it is a crisis is because of its growing resistance. Now, the overuse and misuse of antimicrobials in humans, which we have the antibiotics, even in humans, animals, and agriculture, all this accelerates resistant bacteria. You understand? Now,
Yeah.
it also result to treatment failures. The global impact is that it could cause 10 million deaths by 2050, which can lead to economic burden, to losses, you understand, and
Yeah. Yeah.
mortality. Yes, thank you.
All right. Thank you so much for your time.
Yeah, you're welcome.
Glad to have you. And we look forward to having such conversations next time. So thank you very much for coming to the live session.
Yeah,
All
thank
right.
you very much.
Okay. So for those of you that joined the live session and will watch later, um, this video will be uploaded later, maybe by tomorrow. So if you have not subscribed to this channel yet, please do so because this is what we do every month. So next month we'll be having another guest and we'll be talking about something. This channel is all about healthcare, epidemiology, and public health in general. So thank you very much for joining and
You're
see
welcome.
you next time.
You're welcome, sir.
Thank you, sir. Yeah.
Thank you.